Do we perform bypass on a beating heart? Yes, we do. We even perform coronary bypass surgery minimally invasively, that is with a small incision. In fact, we have surgeries that we perform both with a small incision and on a beating heart. As I mentioned before, determining the process and the appropriate strategy for the ideal patient is the most important point for us. When we do it on a beating heart, as the name suggests, we don't stop the heart. This provides many advantages. In some risky patient groups, if the patient is suitable, when we do it on a beating heart, the intensive care process is shortened a bit more. We can thus overcome some, kidney problems and lung problems. Of course, this applies to the suitable patient. At the same time, we also perform heart surgery with a small incision. In surgeries we perform with a small incision without opening the rib cage. We can enter from the right side, usually under the breast, sometimes through the breast with a video camera, and change the valve. We also perform our coronary bypass surgeries from the left side, again in the same way with a small incision. This is very beneficial for us in the early period. The patient's intensive care process in particular is shortened, and in some age groups, even in every age group, post-operative pain can become unbearable for some patients. With these small incisions, pain is significantly reduced and the patient's recovery time in the early period is greatly shortened. For our adult patients after cardiac surgery, whether it's valve operations, ascending aorta surgery, or coronary bypass surgery, after the operation, surgeries generally take an average of 4 to 6 hours. After surgery, we sometimes wake the patient in the operating room, or they are moved to intensive care. In intensive care, we wake our patient between the second and fourth hour after surgery. Patient usually stays in intensive care for one night and is moved to the ward the next day. After staying in the ward for about 3 to 5 days, we discharge our patient. Before returning to their country for 3 or 4 days here, after being discharged, we host them for another 3 or 4 days. We perform a checkup and then send our patient back to their country. We continue to follow up with our patients with checkups at the first month, third month, sixth month, and then annually. We can also perform heart-related checkups for our patients coming from abroad, and we do this as a team. We have a medical board. In as little as one day, the patient arrives in the morning, gives blood samples, and we perform an echocardiography. In short, it's a heart ultrasound where the heart valves and the heart's contraction are evaluated. Then there's the virtual angio, which we use very often lately. It's become quite popular. It provides us with three-dimensional imaging. It gives us a clear view of the coronary arteries. We examine the main vessel leaving the heart and the pulmonary artery going to the lungs. We can also evaluate the heart muscle itself. After completing all these, we evaluate the patients in a board consisting of cardiology, cardiovascular, and various other branches. We look at it from our perspective, the heart's perspective, while other branches do the same, so our patient goes through a rapid checkup process.